But the reason why vertical incisions are problematic is this. There are multiple layers from your skin all the way to the inside of your belly. There are some very important layers, and I'll run you through them real quick. So you have the skin, which is the stuff that you see. And then everybody where it talks about liposuction and all that stuff. Liposuction is literally the fat that's underneath your skin. So you got skin and then you have fat. Like there's some layers of fat, and that's cosmetic stuff. That's the liposuction stuff. That's the stuff that you see. You squeeze your skin and you get that fat underneath your skin or whatever. That's just the two layers up underneath. Underneath all of that, there is a layer called fascia, right? So fascia is the layer of skin underneath the skin. So you got your skin and the fat, and then you got a layer of skin that keeps everything in, right? So all your intestines, your uterus, your appendix, your spleen, your liver, all of that stuff is really kept into a cavity by a skin layer called fascia, and then you have muscle under there too, or what have you. So it's fascia, muscle, and then a little bit of another little thin layer called peritoneum. And so peritoneum is like the last layer before you get inside of the belly, and you could think of that as like the paint in your house. So you think about like your belly as like the house, right? So the skin would be like the chimney, the fat the fat will be like, you know, the insulation. Your drywall would be like the fascia. Your drywall and your like your boards or what have you, or the real structure of your house is your fascia. And then the peritoneum is like the paint. It's like literally like the paint in the house is keeping and everything or what have you. So when you cut vertically, right? Everything like when you cut vertically, you're anytime you breach something, as it heals, it's never going to get the same strength that it has before it was compromised in the first place, right? So even if it heals, the weakest, it's going to be weak there from the healing standpoint. So think about it like this. Every time you get up from a seated position, like you stand up like this, you sit down like this, every time you do it, just try it, you're using your belly muscles to do it. Like you're using your abdominal muscles to get up, using your abdominal muscles to sit down. Every time like you strain or what have you, you're doing this. Everything does this. The lines of your skin, they go like these. They called the Langerhans lines of your skin, right? They go this way. When you cut this way, you go against those lines. So every time you go, you're basically pulling those lines apart. So that's why when you see people with vertical incisions, it's always thick or it's like it heals like weird because it's thick. It's because you're putting so much stress and strain every time you get up and get down or what have you, and it makes it harder for the body to actually heal because it's compromised right there. Right. So that's number one from a portion. That's why vertical incisions have a higher risk of dehiscence or coming apart, or they also have a higher risk of keloid because you're putting so much strain on them during the healing process all the time. The fascia, which is the layer of skin underneath the skin that holds everything in, also gets stressed every time you get up and move down or whatever. So it's like when you cut into it, you want to cut into it, and the reason why I go so low and that I keep it as small as I can because I want it there to be as little tension on that fascia when it heals as much as possible. So when people get up and they sit down, they can use their belly muscles, but the cut is going this way, so it's going along the lines of healing, so it's much easier to heal. Whereas if you cut up and down, you're continuously putting stress, strain on the skin as well as the fascia, and it causes a weakening. All a hernia is a weakening of fascia or muscle in underneath, and it's allowing the inside of the belly to protrude through that breach or that weakening. That's what it is. So when you have like a vertical incision or what have you, and you have a breach in the fascia, now the contents of the abdomen, the most particularly the bowel, can now protrude through that. And now it comes to the stuff that you can actually see, the fat in the skin. So when you get up to the skin and you see like this big bulge coming in on the skin like that, and it's a true hernia, that means that the skin underneath the skin, the fascia, has a breach in it, and now the bowel has started to protrude through the fascia. And so now when you press on the skin on the outside, you could press actual bowel as it pushes through like the skin and the fat. Now you can't really touch the bowel, but that's what's pushing from the inside. That part should never be pushing from the inside. It should always be staying on the inside underneath the fascia. When you breach the fascia, that's when stuff comes up. So yes, vertical incisions, to answer the original question, vertical incisions increase the risk of hernias. They increase the risk of dehiscence, or that skin coming loose, and they also increase the risk of keloid scars, and fibrotic tissue formation, just because of the healing, the way that the skin heals, and the way that the tissue heals as you know, with that type of incision. So I hope that answered the question. That was a lot, but